Joining me now up front, Dr. Gary Small, Chair of Psychiatry at Hackensack Meridian Health in New Jersey. He's a New York Times best-selling author, and among his books, 2 Weeks to a Younger Brain, now out in paperback, which he co-wrote with his wife, Gigi Forgan. Uh, as they say, truth be told, we know each other for many years now, and it is great to see you, Gary. Thank you for joining me on Upfront.
Pleasure to be here, Ross. Thank you.
Let me begin. We'll get to the book in just a couple of minutes, but let me begin with what everybody is talking about. They will be talking about it for some time. A man from Las Vegas, actually from out here in Los Angeles, walks into a major high-rise in New York City on Park Avenue and shoots up going for the NFL. Turns out he has something called CTE, which is a brain disorder. Let me begin with that. Explain it. How prevalent is it, and what do we do about it?
Well, it is an issue. It actually affects me personally. I'm living across the Hudson River from Midtown. I often go into Midtown, and anytime something like this happens close to home, it raises your anxiety levels. So, CTE is shorthand for chronic traumatic encephalopathy. And this is a condition that affects individuals who have had any kind of head trauma. Often it can be a full-on concussion where you're knocked out, but probably even more often, these are subconcussive injuries, the kind of thing that happens to football players, soccer players, can happen from blast injuries to military personnel, and it kind of shakes up the brain. And I got into this over a decade ago because at UCL, when I was at UCLA, we developed this brain PET scan technology where we can actually visualize in living people these abnormal protein deposits that collect in the brains of Alzheimer's patients. Now, autopsy studies of people who get CTE, and by the way, the symptoms are similar to cognitive decline, Alzheimer's disease, where you see memory issues, you see decision-making and cognitive issues, but you also see a lot of emotional issues and personality change, irritability, aggression, and so forth. So we found in Alzheimer's, you'd see these, what they're called amyloid plaques and tau tangles that collect in areas of the brain that cause memory issues. Well, it turns out in CTE, they had followed some of these people to autopsy, and they find one of these protein deposits in the brain. So we decided to start scanning NFL retirees and military personnel who had had blast injuries. And lo and behold, we saw a collection in the brain of these individuals of these protein deposits. And what was quite interesting, unique about the CTE cases, was that in addition to areas that control memory and thinking, in every case, we saw accumulation in an area of the brain called the amygdala. Now, the amygdala is underneath the temples, and it's an emotional control center of the brain. And it was clear to me when we started scanning these people, they were different than the usual age-related memory loss people. They had a lot of mood issues, they had personality issues, and emotional instability.
The New York medical examiner will be the person to give the final autopsy, and he shot himself in the chest, apparently leaving behind a note that said he wants his brain to be looked at. What's your perception on this? Do you think that medical examiner will indeed, it's up to him or her
Well, we don't know. I mean, today, it's you can't really make a diagnosis of CTE just from clinical symptoms. I mean, the studies that we do on it, we call it suspected CTE based on the constellation of symptoms, the mood, and the behavioral and the cognitive issues that we see with a history of head trauma. And we'll just have to see what the autopsy shows. And in fact, the fact that this guy killed himself, it's certainly consistent. Some of these people get suicidal, and that's one of my scientific collaborators, Bennett Omalu. He was the first person to do autopsy studies on NFL players who had committed suicide, and he revealed these abnormal tau deposits in these individuals that had previously been seen in boxers, because
Mhm.
we know that considerable head trauma in boxers.
Under normal, autopsies, would they look at the brain? No.
Well, it depends. Often, certainly I'm not a pathologist or a forensic pathologist, but from what I remember in my medical school days and my work at the Alzheimer's Center at UCLA,
Mhm.
well, the Alzheimer's Center at UCLA, yes, they do the brain each time, but a forensic autopsy, and certainly in this case, I'm sure they're going to examine the brain because of the suspicion.
So we'll see what unfolds as time goes on.
But, one of the take home here is, we're talking about how to protect our brains as we age and keep them younger. Uh, Take home is wear a helmet if you're gonna ride a bike or a scooter. Uh, Wear a seatbelt. Take care of your head if you can.
And we won't get into football today, but we'll do that at another time. Which
Well,
brings us to the book that's now out in paperback, 2 Weeks to a Younger Brain, which yeah, you name the person I know, they'd say, "Yeah, I'll that's a good idea." Uh, you begin the book by asking, and I love this, begin the book by asking, "Have you ever walked into a room and forgotten why?" Yes. I've said this to several people just the other day, and they said, "Yeah, of course I have." That's common, correct?
it is common. Now, if I walk into the kitchen and I forget, well, I can always get a snack, so that's not it's not a total loss. But, as our brains age, they function differently, and, some people, it alarms them, particularly if they have a family history of Alzheimer's. Every little middle-aged pause or senior moment freaks them out. But, these kinds of, issues are very common, and in fact, by the mid-40s, the average person has a significant objective decline in their memory abilities. So it's a gradual process. Just because that happens doesn't mean you have to start labeling everything in your house. It doesn't mean it's going to progress rapidly. But if it is disturbing you, I always recommend seeing a professional, finding out what's going on, because it's easier to protect a healthy brain. You nip it in the bud if you deal with it early on rather than wait.
Well, I wanna talk about some of the ways you should deal every day with diet, so on and so forth, but I wanna talk about age and when you're younger. Um, when I'll take it 26 when I was hosting my show in Washington, 26, 27. It was a 90-minute daytime talk show, so we had sometimes 4, 5, 6 guests like yourself, news breaking items, authors, books. And, that wasn't a problem for me. It would be Dr. Gary Small is on, and so what the hell is his name at the end? Because he just came on. Now, here's the weird part. So I'm 25, 26, and I wanna know how normal this is. And I would always forget those names back then. But one thing, again, back then, so 25, 26, 28, 4 years later, I could see that guest on the street in Midtown Manhattan, Washington, DC, or North Carolina. "I know you, I had you on the show." And they go, "You did?" And, if they didn't remember, yeah. So I remember faces very, very well. Names, is there something to actual physical stuff that you can remember better, or is everybody hardwired differently in their brain?
Well, certainly everybody is hardwired differently. That's for sure. But there are um, trends that we see, and certainly your brain is good at visual imagery and visual memory. In fact, in our first book, Gigi and I wrote the Memory Bible. We introduced a simple technique uh, to help with memory, and it's actually quite good for names and faces. I'll show you what I mean. And it's all you have to remember is look, snap, connect. So look is a reminder to focus your attention.
Uh-huh.
Snap is a reminder to create a mental snapshot, and that leverages the brain's visual memory, and connect is a way of making it meaningful. So if you can make something meaningful be memorable. So say names and faces. So let's say you meet um, Mrs. Bangle and she has bangs. Well, that gives you a visual image, helps you with her last name. And maybe her first name is Sue, and she tells you she's an attorney. So that helps you remember her first name especially if you've ever been sued, that becomes an emotional memory. So, I mean, those kinds of techniques can certainly help to compensate. But Ross, uh, 85% of people as they age, they complain about the same thing. They can remember faces, but they can't recall the names. So it takes a little extra mental energy to remember those names, but it's certainly very feasible.
Where did you begin your research for this book? What did you do? How did you start?
Oh, goodness. This is my lifetime work. When I was at UCLA, I directed the longevity center there, and we just did so many studies in this area of early detection of Alzheimer's. I mean, I guess I started out in Alzheimer's. My mentor was an Alzheimer's researcher, but it struck me this is a very gradual process. And so I thought, let's see how early we can detect this. That got me into brain imaging and the PET scan and MRI research. And we would, and then also genetic research. I've been so fortunate. I was part of the team that discovered the first major genetic risk for Alzheimer's disease, ApoE4. And so we started combining the genetic information with the brain imaging information. We could find abnormalities in the brain 10, 20 years, 30 years before people had symptoms. So we could detect that process early. And then it got me to thinking, look, there's some interesting studies here about lifestyle, how it mitigates what happens to the brain. If it's good for your heart, it turns out it's also good for your brain. So I got started on the lifestyle studies and doing those interventions. And it's just been so gratifying. And fortunately, I married Gigi. It was, I should remember this, 36 years ago. And at the time, she was a screenwriter, and she actually started out as an actress and got into TV and film writing. And I never dreamed that, oh, I'm going to marry her because then we can write books together. But 10 years later, we started writing the books, and it's just been a joy.
What is the difference between dementia and Alzheimer's?
Well, dementia is kind of a generic term, and it means that you've had a cognitive decline, which could be a memory decline or decision-making decline, whatever it is, a cognitive decline to the degree that it interferes with your ability to take care of yourself. And a lot of different things can cause that. I mean, you could have small strokes in the brain. You could have a medication side effect. You may be taking Benadryl for allergies, and as you get older, that can cloud your thinking. The most common cause of dementia is Alzheimer's disease, and that's where you have those abnormal protein deposits I mentioned, plaques, amyloid plaques, and tau tangles, and it's a very gradual onset. So that, I think people confuse those two. I remember once seeing a family and they came in and they said, well, thank God, Dr. Small, the last doctor told us it wasn't Alzheimer's disease. It was only dementia. Sometimes dementia can be pretty bad, even if it isn't Alzheimer's.
A couple of minutes ago, you mentioned lifestyle stuff. There is a recent conference on Alzheimer's, an international conference on Alzheimer's, and some of the things they've been discussing sound like the docs talking about heart disease. They want you to get out and exercise. That could
Yeah.
they're saying, and correct me if I'm wrong here, that in this case, you may be able to either prevent or slow down onset Alzheimer's?
So it's, in terms of there's no cure. If you think of the word prevention as a cure, we don't have that. But the data are pretty compelling. This recent study that was just reported, the Alzheimer's International Conference, it replicates an earlier study done in Northern Europe, a very large study, and also replicates smaller studies that my team had done. When you start combining these lifestyle habits that I describe in a practical way in our book,
Mhm.
uh, regular physical exercise, a Mediterranean style diet, stress management techniques, mental stimulation, and ways to compensate for your memory, it really makes a difference. And what they found in this new study is that they had two groups. They had one group where it was self-regulation. They said, here's what you got to do, and very little help from professionals. The other one, it was a little more of a structured program where they had a lot of professional prompting and so forth. And the one with more prompting, those people did better than the ones who were just left to their own devices. But both groups did significantly well. And you can stave off symptoms for years.
Also in the book, you discuss video games and word games. Video games, I found very interesting. Word games, I get. Video games, why? Why? What? How does that help?
Well, it depends on which game you're playing, and this is in contrast to the Oxford 2024 term of the year brain rot, which refers to spending too much time with your devices doing unchallenging, mindless tasks. If you're there are certain they've actually studied this quite systematically, where they've looked at certain kinds of video games where it can improve your intelligent quotient, it can improve your multitasking skills, it can improve your hand-eye coordination. So it depends on the game. I mean, there are games, some interesting studies on games that are kind of the typical race car games. You got to keep a race car on a track, and they're distracting and informative signs that pop up and down, which boost multitasking skills. And you find you can train an older person to multitask like an untrained younger person. There are other games that are like, the old game of concentration where you turn over a card, try to remember where they are. But this is concentration on steroids. So it's really hard. You have to remember a sound and a grid, and that improves what's called working memory. That's very short-term memory where you hold information in mind to solve a problem. You can train with those games, and it actually transfers to improve your problem-solving skills, a component of IQ. So, yeah, and there are another one, fun fact, surgeons who play video games make fewer errors in the operating room. So, Ross, next time you have elective surgery, don't ask where they went to medical school, find out how much gaming they're doing each week.
You bet. You also talk about word games, and I hit one of the pages with the J's and the G's, and I said, I can't. I'm giving one thing away on this. It was jogging. I said, "Is he kidding me? I couldn't. I would." Some of these word games are difficult.
Okay.
How do you solve this stuff?
Here's the tip. Train, but don't strain your brain. Okay. You got to find that sweet spot where you're kind of solving the problem and you have that aha moment and it feels good. Uh, but if it's too difficult, it's going to be stressful. If it's too easy, you're going to get brain rot. Okay.
But
So
that stuff is good. Scrabble is probably good too.
yeah, I mean, if you have a good opponent and you get some decent letters, yeah, Scrabble. I like to look. I've done crossword puzzles. My whole family did crossword puzzles, and I always did them because I find them relaxing. They're enjoyable. But it turns out crossword puzzles they help your cognitive function.
On that cognitive note, President Trump took the cognitive tests. I scored. I don't know what the hell that means. I scored 100%. Is there such a thing? You score 100%?
Well, first of all, I don't want to get political because I
No,
want
no,
to
no,
sell.
no, no politics.
I just want to sell books to Republicans and Democrats.
Yeah,
Okay.
we are even Steven. I just want to know about the test. If I know
Well,
this,
here's the test. I mean, there are cognitive screening tests like that. He took the MOCA test, which is the Montreal Cognitive
uh,
Assessment Screen. And what it does, it gives you kind of a general idea if there's a big problem. It's not that difficult. Someone who's educated is probably going to do fine with that. To really learn if there's a subtle problem, you have to do more in-depth, what we call neuropsychological tests. And those take a bit more time, and they kind of tease out subtler forms of cognitive decline, particularly in people who are educated. There's another test like the MOCA test called the mini mental state exam,
mhm.
and that's a little bit easier. And what they do often is they rate that depending on how many years of education you've had. If you had more years of education, it's not quite as sensitive.
Foods, alcohol, caffeine. Let's take those foods. I love blueberries. A lot of people say it's broccoli. Other people say, well, what is the food or foods that are best for your brain?
Okay, well, it's a brief summary. First, try not to overeat because we know that midlife obesity quadruples your risk for late life dementia. Okay. So, calorie control, there's something to that. Another point is to try to consume what we call anti-inflammatory omega-3 fats. So there's different kinds of fats in our diet, and omega-3s you can get from all actually Omega-9 is good too from olive oil, but omega-3 is from fish and nuts, and they reduce inflammation throughout the body and the brain.
So
And,
salmon is good for you.
yeah,
Salmon, yeah.
yeah. Well, another side of it is don't overdo it. Let's go back to moderation because too much elevates your mercury level, and that can affect your cognition and cause some other health problems. Another thing you mentioned, blueberries. Fresh fruits and vegetables, colorful fruits and vegetables, they reduce oxidative stress, and that causes wear and tear on the brain cells. And then finally, try to limit those refined sugars and the processed foods, especially the ultra processed foods, because they're not good for your brain health. They're not good for your heart health, and they actually increase your risk for type 2 diabetes. If you get diabetes, that doubles your risk for dementia.
One other on the food side, chocolate, dark chocolate, yay, nay?
Well, it's antioxidant, but if you consume, pounds and pounds of it, that's not good because then you're gonna get obesity, and the kind of obesity that's a problem is what we call central obesity. It's fat cells around the abdominal organs, and those are pro-inflammatory fats. I talked about the plaques and tangles, the amyloid plaques and the tau tangles. That is what defines Alzheimer's disease. But we also know that heightened inflammation is bad for the brain. And a lot of the research I've done over the years is to try to reduce inflammation. We've looked at anti-inflammatory drugs. And also, we did a study about 7 years ago now, looking at the spice curcumin. It's from turmeric, and it's anti-inflammatory. And we found after 6 months, it had significant benefits for memory and attention.
So the anti-inflammatory, if your doc says a baby aspirin is good, that's probably good.
Well, it is good, but I think you got to be careful with it because, especially as we age, uh, aspirin, and particularly people are taking ibuprofen or Motrin or naproxen, uh, and Advil and so forth. And those medicines do have a lot of side effects. And so you got to be careful. It can
Oh, I
cause
said the
stomach.
baby aspirin, the 81, whatever they're called, the
Yeah, but there's no evidence that a baby aspirin does that much. We did a study of Celebrex or celecoxib, and we found it did mitigate cognitive decline in middle-aged and older people. These were people with mild memory complaints, but other studies have found that it ain't so good if you already have dementia. So you got to be careful. That's why we've looked for safer approaches like curcumin, which has very few side effects.
you talk about caffeine, you say little caffeine, coffee, not so bad.
That's right. Actually, uh, caffeinated beverages like green tea or black tea or coffee, people who drink that in moderation have a lower risk for Alzheimer's and Parkinson's disease.
And on the other end, this one's confusing to me because alcohol, and I don't know if the latest printing says the paperback says alcohol is good. Eh, I always heard a drink a day, not so bad. Now they're saying be careful, especially for women. What are the findings showing now?
It is confusing because each study, depending on how it's done, who are the volunteers, what are the measuring items, gives you different results. Most of these studies of alcohol have indicated that in moderation, one drink for a woman, maybe two drinks for a man, it's okay. And it may be that it relaxes you and cutting down on stress and decreasing anxiety is good for your brain health. But more recent studies suggest that it's not so good for your heart and for your brain. So I think, people have to individualize it and think, um, you know, the joke is, I don't know that I'm living longer, but my life seems a lot longer since I gave up all.
Um, Sleep. What do you say in here about sleep? What do you find as we age we need in terms of sleep? They really scare you in terms of you didn't get 8 hours. Not everybody needs 8 hours, do they?
They don't, and people need to realize with age, you have lighter sleep. There's more frequent awakenings during the night. A lot of people stress out about that.
Uh-huh.
And, one thing that you can learn, and we describe it in the book, ways to settle yourself down and sleep without medication. And you can have sleep hygiene methods where you go to bed at the same time. You don't want to have a lot of screen time right before you go to bed. I find something really helpful is listening to books, and
Yeah.
especially if it's not a particularly engaging book or exciting book, set it for a half hour. It's like a bedtime story, and I drift off.
And I've found I meditate. I've found, that you get those 4 hours or 5 hours in, and you wake up and you can't get back to sleep. I found meditation really helps as well. So you meditate, you
That can help, or listening to waves,
waves.
uh, any kind of mindless activity that sort of grounds you. The problem that people have with sleep is that they tend to ruminate and they think about things going on in the day, and it wakes them up.
And if you needed 8 hours in your 20s, in your 60s, you might not need 8 hours. You might need 6,
Right.
and that's
I
okay.
think people, yeah, you just need to take note of how you feel and what works for you.
In the book, do you talk about how if you can't remember something, how you can pull it out of your memory? How do you and I didn't find that, but is there are there ways?
Well, I mean,
Because I
I
do
don't.
this at times.
Okay. Now are you referring to the tip of the tongue
Yeah,
phenomenon where
yeah, yeah, yeah.
okay.
This is very
So
interesting.
let me, so again, I mentioned look, snap, connect, coming up with visual images. And I don't know if here's an example that just rings true for me. Many years ago, Gigi and I, we saw this movie with Jeremy Irons, and he played twin obstetricians. So he played both each twin, and it
Uh-huh.
was a brilliant performance. And every time we'd see his name or he was in something else, I'd say, "Well, geez, what was the name of that movie? I know it was a Twin Peaks. No, no, that was a TV series. We just never remember. That was a tip of the." So here's how I remember it. I visualize, first of all, the memories live in neighborhoods, and that Jeremy Irons memory is very strong. So that's fixed. So what I do is I visualize Jeremy Irons playing dead with rings on his fingers, and that brings me the name of the title of that movie, Dead Ringers.
Oh, that's how you do it. Okay.
Do that
Sometimes
with anything that's a tip of the tongue.
I've also found that sometimes if you stress over trying to remember something, go away from it. Come back and maybe you happen on something I was thinking about with us. I know you for years now. We met through mutual friends back east where you are now. And I remember having lunch with you. I don't know if you're going to remember this. It was in Westwood Boulevard, as a matter of fact. You remember that place where it was? I couldn't think of it. It was driving me nuts. I was thinking about this today.
Boy, it's funny because I thought it was in Brentwood, but you may be right.
So I'll tell you how I backed into it. I said,
Wow.
I'm trying to think if I thought it was farm because there's a couple of farm restaurants here with the name. But I said, "Man, it wasn't that. It just wasn't that." And I kept thinking, I was, where, what, where? And I thought, and then I thought about up north. I said, yeah, it was Napa, the Napa Grill.
Oh, it was a Napa Valley Grill, yeah.
That's the first time I ever, it was the
Well,
Napa.
that's you use the same principle. So you have certain they do our memories do live in neighborhoods. We have associations. So you might be driving along and you see something else. Oh, now I remember what I was trying to remember. Right?
Yes, but I started to get, as I do always do, very upset and very, "Oh, damn, so I'm going through this and then I kind of pieced it together. So this piecing together really does really does
It
work.
does work. Yeah. But it takes a little mental work. And I think, what I'm trying to do is reassure people that this is a normal part of aging, not to fret about it. As you say, don't stress out about it. Let it go and it'll come back to you.
In the couple of minutes we have left, where do you take your practice now and you're back east, at least for a while. You'll be back in Los
Yeah.
Angeles. Um, you do a lot of geriatric work. Where do you what's the frontier? What's the next horizon in the psychiatric world for people? Is there something you guys are working on we should know?
There's always research going on in new drugs. And, for example, I talked about the curcumin. I remember when we published our paper in 2018, there was a professor from Taiwan who was
Mhm.
so excited by that paper. He flew out with a colleague and he said, "Well, I'm going to take this to the next level." Lo and behold, he's developing a curcumin like product in Taiwan. He's got, and he's developing it as a drug. And, I'm honored to be his chief global clinical trial consultant. And, so there's a there for some of these ideas that have been developing over the years. And I think with a lifestyle, what we need are public policies, ways to motivate people to live healthier lifestyle. I mean, what happens, I'll meet with people as a clinician and I'll say, you got to eat right and exercise. And many of them will say, well, that's fine, doc, but do you have a pill? So it's hard for people to change their lifestyle, but
Yeah.
we need ways to encourage them to do that. I think this conversation today is a good way. And let me also mention, in terms of mental stimulation, just a stimulating conversation is shown to help your cognitive health.
That's why social people, all that stuff is
Right, they do better.
The book is called 2 Weeks to a Younger Brain, an innovative program for better memory and a sharper mind. Dr. Gary Small, thank you. Come on back and let's do this again. You've got other things, and I want to talk about the changing of your person. You wrote a book on changing your personality.
Oh yeah, we talk about personality change and so forth. I'll be back next time. Maybe we'll do it on the West Coast.
That would be fun. That would be fun. Always a pleasure. Gary Small,
Okay.
thank you, Gary. Good to see you,
Sure.
and we'll talk soon.